Okay, so let's start with a patient with malignant mesothelioma. This PET-CT shows the characteristic features of a patient with malignant pleural mesothelioma. What are the characteristics features? First of all, you see the parietal pleura. You shouldn't see the parietal pleura normally. Let's look at the left-sided hemithorax because since the parietal pleural thickness is about 20 micron, it is well below the detection limit of the PET-CT. So you shouldn't see any parietal pleura normally. The second one is you see a very thick parietal pleura, which is one of the signs of malignancy. And also, as you see, the pleural surface is irregular. So it is another features of malignant pleural mesothelioma. And also, if you look at carefully on this PET-CT section, you can easily notify that the right hemithorax a little bit smaller than the left hemithorax. So it is another feature of the mesothelioma. And the fourth feature here is the avidity of the parietal pleura. So it is orange, the color is orange. It means that the parietal pleural cells, namely mesothelial cells, but in this case mesothelioma cells, uptake glucose, radioactive glucose, very intensely. So these four features are very important in order to suspect mesothelioma in a patient with chest pain. So can you tell me why they are throwing water on the building here? Do you have any idea? You have some ideas about this, probably. Why? Because of the asbestos. So mesothelioma is a parietal pleural tumor, as you see on this picture, this illustration. It is totally a parietal pleural tumor, but in extensive stage, this parietal pleural tumor invades the visceral pleura and also the fissures and even diaphragm and mediastinum. So there are two main types of mesothelioma. One is epithelioid type. The second one is sarcomatoid type. Malignant pleural mesothelioma is an uncommon and lethal cancer. Uncommon in other Western countries and most of the world, actually. It is not uncommon in Turkey. And it is a pleural tumor, and it is related to asbestos exposure. There are different kinds of asbestos. Among them, amphibole type, subtype of asbestos, especially crocodilite subtype of asbestos, is important in terms of mesothelioma carcinogenesis. So asbestos, it can be found in the soil. It can be mined, actually. It is seen like this. It is very abundant in some parts of the world. I will show you why. Asbestos has been a very, very good, almost perfect isolation material. It is very good isolation material for heat, electricity, for water, for sound. It is a very good sound proofing material. Actually, and also it is very cheap and it is very easily applicable material. And also it can be mined from the soil, so it can be found abundantly in, as I said, some parts of the world. So this is a old car, train car, which has isolation material of asbestos. Also, it was used for pipes, household pipes and industrial pipes very widely. And when you look at the crocodilite, which is the most important type of asbestos in terms of carcinogenesis, it seems like this. It is called also blue asbestos. The color is bluish if you look at very carefully. So it has been used for proof isolation material, as I said before, and it has been used for roof isolations. As you see, this is, if you see this kind of material, you can be sure that it is asbestos. And it has been used in ships because of the isolation properties of asbestos. And in Western countries, especially in England, in which the shipping industry has been very prominent for at least 300 years, it was seen, the mesothelioma seen in the patients who worked in these shipyards. And usually it was diagnosed after 60 years of age. But in Turkey, there is a different story. Before talking about the situation in Turkey, I want to show you the material, the asbestos material. As you see here, it is very easily applicable. It is a very easy material. It is malleable, shapeable, very nicely shapeable. It is almost perfect, as I said. The only problem is having carcinogenic properties. So in order to understand why asbestos can cause mesothelioma, we have to look at asbestos fibers very closely. This is scanning electron microscope pictures, the views of the asbestos fibers. Chrysotile is white asbestos, and it seems like this, as you see here. If you are a person like me who wants to learn the formula, the chemical formula of the material, this is the chemical formula. This is totally inorganic, and there is nothing. There is no properties of carcinogenesis for this material. So why does it cause asbestos as mesothelioma? During this lecture, probably in 40 minutes, I am going to conclude it in 30 minutes. You will inhale hundreds of thousands of particles. If now your environment, in your environment, if the air is clean as an air in operation theater, it means that it contains approximately 1 million particles per cubic meter. So during this lesson, during this lecture, you will inhale approximately 200,000 particles. Some of them are viruses, some of them are inorganic particles, some of them are bacteria. But don't be afraid of these particles, because some of the particles will be captured by the larynx and the upper airways, and some of the particles will be captured by the tracheal ciliary system. If these particles can reach into the alveolar system, alveolar macrophages can engulf and destroy these organic particles, because the alveolar macrophages contain DNases, proteases, RNases, and oxygen burst mechanism that can disrupt almost all organic particles, including proteins, prions. But there is no enzyme called asbestos. There is no destroying enzyme that destroys asbestos inside the alveoli. For this reason, asbestos fibers accumulate in the alveolar system, and then they transpasses the alveoli, and they can accumulate around the parietal pleura, as you see here. but they continue to induce immune response. Immune response leads to DNA damage because neutrophils and the macrophages contain DNases, RNases, oxygen burst mechanisms. Fortunately, most of the DNA damage leads to cell death because this is the purpose of this. The damage of the bacteria, killing the bacteria and viral particles. But this immune response doesn't cease because if there are bacteria inside the alveoli, after the killing of whole bacteria, the system ceases, the immune response diminishes. But in this case, since there is no asbestos destroying enzymes, the immune response continues indefinitely. And there will be accumulation of DNA damage. And unfortunately, some of the DNA damage can cause malignant transformation, in this situation, mesothelioma. In 1970s, simian virus 40 was contaminated. The polio vaccine was contaminated by simian virus 40. And in some of the mesothelioma patients, the etiology was due to simian virus 40, which is a kind of oncogenic virus. But today, polio vaccines are free of any viruses, any contamination. So this is the tumor, as you see here. There is one other molecule, one other mineral that causes mesothelioma in our country, which is erionite. Erionite is very similar to asbestos, and also it is found in the soil. And as you see, if there is an asbestos anywhere, it is this sign should be put. Today, dismantling workers should have this kind of protective equipment, this kind of protective materials when they work, and there should be this kind of warnings. But for Turkey, there is a very different story, actually. The story began approximately 300 million years ago. Because according to geological researchers, there was only one continent called Pangaea. And Pangaea started to be broken down just 200 million years ago. And as you see, continents, 7 continents have been formed. But look at this area here. Approximately 60 million years ago, there was an inner sea called Tethys Sea. And this sea dried out, and it has become Anatolia. Yes, now the Anatolia has been formed, as you see here. This is very important because geologically, the floor of the oceans contain very large amount of asbestos. This is probably because of the sediments of the microorganisms. İzzettin Barış, who died 3 years ago, worked at Hacettepe University Pulmonary Medicine Department. He began to see many patients with mesothelioma in 1970s and 1980s. And he wondered why many patients came from some parts of the country, especially from Kayseri, from Karayin, Niğde, Nevşehir. And he began his very enlightening journey. Actually, that journey was not a metaphoric one, but the real one. And he collected many samples around Turkey, and he found that soil in Turkey is rich of asbestos. because of the geological reasons that I mentioned about. But you can ask, okay, the soil is rich of asbestos, but how do we expose the asbestos? I will show you how. This picture was taken in one of the markets in eastern Anatolia. These clumps are sold in the markets, and people bought these clumps, which are very cheap, and put these clumps into the tin with water, and they use it for whitewashing and plastering of their houses, as you see here. But make no mistake, this is not a normal paint. This is not a paint with calcium. This paint is made from the soil. And this asbestos containing material can be very easily pulverized. And shipyard workers usually start to inhale asbestos when they started the work, the factory work. But in these areas, in these very large areas, the people actually start to inhale asbestos after they are born. This is why the incidence of mesothelioma is so high in these areas. This is one of the cottage houses. Tize is looking at us. And also there are some asbestos mining facilities around the country. This is one of them, as you see here. There is no protection. This is totally asbestos. So actually İzzettin Barış Hoca discovered Karain. And you can see Karain in many textbooks, even in pathology textbooks, thoracic surgery textbooks, not Turkish ones, the international ones, and also pulmonary physician textbooks. Why? Because Karain is one of the most important sites, villages in the world in terms of mesothelioma. In Karain, unfortunately, 1/3 of people had mesothelioma and died of mesothelioma. They İzzettin Barış Hoca found that, observed that the people start to prepare their tombs when they are 20s, because they know that they will die because of some kind of lung cancer, but it is not a lung cancer, of course. He started the movement actually against this area, and he warned, Professor Barış warned the governments at that time and the Ministry of Health. But many governments were not able to move the people. 2 years ago, there was a good news. And as you see here, the people in this area are moved actually into normal concrete houses, which is very nice for these people. Of course, in the environment, there is a pulverized asbestos, but at least they live in normal houses, concrete houses. Muzaffer Metintaş has been worked as a professor recently, actually, and they performed a recent study showing the population with asbestos exposure in a very detailed way, more detailed way than İzzettin Barış Hoca did. As you see here, there are many villages in Turkey in which the people are exposed with asbestos very widely. And when we look at the incidence rates, in normal villages in which there is no asbestos exposure, the incidence is about 2 per 100,000 per year. But in the villages with continuing asbestos exposure, it is 40 times higher here, as you see here. The problem is important, a problem in Australia, actually. They don't use white clumps, white soil clumps to whitewashing their houses. Fortunately, the indigenous people in Australia has been actually not settled people, and for this reason, only some parts of Australia in which there was a asbestos mine are exposed to asbestos, and these places were known to be rich of mesothelioma patients. But fortunately, they banned to enter these kind of areas some tourists visiting there. Expected incidences actually will be lower in coming years, as you see here, because of the awareness of this asbestos exposure, as you see, but it will not be very low before 2033. So mesothelioma is a diffuse pleural tumor. Epithelioid and sarcomatoid types are the main types, but there is desmoplastic type, which is very rare. There is biphasic type, and there is very rare type of localized malignant mesothelioma. This is one of our patients who was published by us approximately 8 years ago. This is very rare, localized malignant mesothelioma, because it is not localized. And there is well-differentiated mesothelioma, which is, again, very rare. And adenomatoid tumor has been recently some type of mesothelioma, but it is not malignant and very rare. The cardinal symptoms are chest pain and chest discomfort. Chest pain is very, very important, and patients describe chest pain increasing during nighttime. As a general rule, if a pain increases during nighttime, it can be, the reason can be malignancy. If a pain relieves during daytime, if it is high in the morning and it relieves during the daytime, you should suspect of inflammatory disease. If a pain increases during daytime, you should suspect of degenerative diseases. So dyspnea, cough, fever, and dysphagia can be found in some of the patients with very large tumors, and hoarseness can be notified by the patient and the doctor, the physician, if the tumor invades mediastinum and also recurrent nerve. So I have shown you that chest CT is very important and PET CT is very important for diagnosis. But when we look at the chest radiograph, we should describe the costophrenic sinus blunting and also pleural effusion and or pleural thickening. You cannot discriminate the pleural thickening and pleural effusion when you look at this kind of chest radiograph, but you should order chest CT or PET CT when you see this kind of radiograph. And you can notify that the left-sided hemithorax is a little bit smaller than the right one. So this is one of the features of malignant mesothelioma, as I told you. And PET CT should show SUV positivity around the parietal pleura. FDG uptake pattern should be focal or linear in early stages, but you should expect to see mass lesions in advanced stages, as you see here. Maybe the question would be, is PET CT enough or appropriate for the diagnosis of the malignant mesothelioma? In order to answer this question, I want to share this slide. The left part of the slide shows a patient with malignant mesothelioma. So you can see the thickened pleura with SUV uptake, as you see, and also the pleural thickness is irregular in shape, as you see. The SUV max is 11.7. The right side of the slide shows again a patient with pleural thickening, and also PET-CT is positive in this patient, but the diagnosis is tuberculous pleuritis. So in order to make a definite diagnosis, one should take a biopsy from this thickened, irregular shape, irregular SUV positive parietal pleura. I told you that if the mesothelioma is at extensive stage, we should expect to see large mass lesions, as you see in this patient. These are large mass lesions. This doesn't mean that the lesion is inside the lung. This means that the parietal pleural mass is so big that it fills the hemithoracic cavity, and it seems like a mass. This woman had a very extensive stage mesothelioma, as you see here. Even the fact that she was very young, she had a very extensive stage mesothelioma, and it was inoperable, unfortunately. And you may ask that if you you find or you have seen a patient with irregular parietal pleura, should we biopsy right away, or should we make a diagnosis of a mesothelioma in those patients? The answer is no, because asbestos exposure can cause a benign situation, which is called benign asbestos. This patient was born and raised in Çermik, Diyarbakır, in which the soil is rich of asbestos and erionite. And as you see, the patient has a bilateral pleural thickening, but he has no pain during night or day. So we didn't want to take any biopsy from this patient, but you should follow this patient up. And we have been following this patient up. There are some paraneoplastic syndromes such as autoimmune hemolytic anemia, hypercalcemia, hypoglycemia, and hypercoagulability, and inappropriate ADH syndrome. But unfortunately, these paraneoplastic syndromes are seen in only 10% of patients. I said unfortunately because it would have been very nice if these paraneoplastic syndromes had been seen in most of the patients, because these paraneoplastic syndromes would have been the diagnosis of mesothelioma easier, but it is not. Autoimmune hemolytic anemia and these paraneoplastic syndromes can be found at other neoplastic situations. So how can we diagnose the patient? Pleural cytology is very helpful. Transthoracic needle aspiration biopsy can be done in the patients with pleural masses. TrueCut biopsy is not like a fish bait needle, and it can provide large chunks of large pieces of tissue, which is very useful for the pathological diagnosis. VATS, video-assisted thoracoscopic surgery, is very helpful, but of course we should start with the non-invasive method, and if we don't have the diagnosis, we can proceed to the more invasive methods such as VATS or thoracotomy, which is very, very rarely needed. What do we expect to see during VATS? This is one of the VATS appearances of one patient with mesothelioma. Remember, I told you that mesothelioma can be seen as pleural thickening and mass lesions. This patient actually has two kinds of lesions, pleural thickening and mass lesions. And biopsying these lesions can provide diagnosis of mesothelioma in most patients. So how do we stage the patients? Actually, there are T factor, N factor, and M factor. But I don't want to talk about N and M factor, and I don't want to talk about P, T3, and T4. The most important T factor is T1. T1 means the tumor involves ipsilateral, parietal, or visceral pleura only. T2 means the tumor involves ipsilateral pleura with invasion of the lung and or diaphragmatic muscle. T1 is the most important one, and we want you to remember T1 for two reasons. First of all, we don't actually know, for example, the starting point of lung cancer, because it can arise from bronchus, alveoli, interstitial tissue, or some submucosal glands. But we know for sure that the mesothelioma arises from parietal pleura. So this is why this is important to know that T1 is the starting stage of the tumor. The second reason that the T1 is important, that we operate T1 patients. But I must confess that some of the T1 patients are found to have T2, and we continue to resect T2, but we don't resect T3 or T4 lesions. So treatment modalities are fourfold. Chemotherapy, radiotherapy are implemented in most of the patients, unfortunately. Surgical therapy can be performed in small number of patients with T1 disease, and immunotherapy recently has become some kind of therapeutic option, but it was not reimbursed by our national insurance system right now. So how do we do the surgery? First, there is a surgery for the intention to treat. It means that we intend to treat. Pleurectomy decortication is the name of the surgery. And also palliative surgery can be performed, like pleurodesis and decortication. So I want to show you what those terms mean. So normally parietal pleura, like this is lung, and parietal pleura is very thin, 20 microns thick. Because of the tumor, the red drawing represents the mesothelioma. It becomes very thick. So pleurectomy means we resect the parietal pleura, and decortication means we resect the cortex of the lung, which shouldn't be there, because visceral pleura is one thing, which is normal, which is physiology, but the tumor invades the parietal pleural tumor, invades the visceral pleural surface, and it becomes cortex. This is why we do decortication, removal of the cortex, which is the thickness, the oncological tissue just onto the visceral pleura, and also we remove the parietal pleura. This is why it is called pleurectomy plus decortication. So in some patients, if it cannot do parietal pleural resection because of the invasion of the pericardium or diaphragm, we do pleurodesis or decortication in some patients. So these remaining slides will show you how we do pleurectomy decortications. We do thoracotomy in most patients, as you see here, a very large incision. Usually we tend to make a little bit smaller incisions, but at the sixth intercostal space. This shows how we do pleurectomy, as you see here. This is the pleura. During operation today, you probably were able to see the normal pleura. It was a little bit thickened, but it was somewhat normal pleura, parietal pleura. It should be like a onion shell normally, but it becomes 1 centimeter thick if there is a tumor. So we do this kind of dissection, as you see here. This is pleurectomy. And also, since the cortex extends into the fissure, so we have to remove the tumor inside the fissures, which is called decortication. Sometimes we have to resect the diaphragm and the pericardium. And then we have to reconstruct the pericardial and diaphragmatic tissue, as you see here. This is PTFE, polytetrafluoroethylene material, which are inert and very safe and very malleable materials. But we do this kind of reconstruction in a very small number of patients, because we usually operate the patients with T1 tumor, but sometimes, as I told you, the tumor was turned out to be a T2 tumor during the operation. So this is, for example, 39-year-old male. He came to us with chest pain increasing during last 6 months, during nights. He was a worker at galvanization factory. You see the thickness, and resected specimen looks like this from cortex, diaphragm, parietal pleura, and other mediastinal surfaces. Okay, of course, it cannot be a 100% resection of the tumor, unfortunately, because we tend to remove the tumor around the surface. Some of the surface areas cannot be removed. For example, around the hilar structures, around the aorta or atrial confluence cannot be removed. For this reason, we do cytoreductive surgery especially. This is only operation in thoracic surgery in which the cytoreductive surgery works. But we send the patient to chemoradiotherapy. So multimodal therapy should be applied, should be implemented in these patients. This concludes my lecture here.